the platform, so I chose speed. So for videos, I watched mainly crash course, and for MCQs, I just went through one time like all the MCQs for videos.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute and Institute of Speed to Dr. Devender for scoring
Yes,
a topmost rank of 26 in NEET SS 2025 session in group of
yes.
DM Medical Oncology. Congratulations to you, doctor.
Thank you, sir.
So it's great to have you in the session. I also thank you for sparing your time to share
Yes,
your valuable experiences with us and to the students watching this video.
thank you, sir.
Great. Now, can we know a detailed background history from where you started till date, what all you have done?
So I've done my MBBS from MMISR Ambala. Right now, I was doing my MD from JLN Medical College, Ajmer. Uh, so my background is radiation oncology, sir. Yes, sir.
Excellent, excellent, great. Now, do this DM super specialty of DM medical oncology. Who inspired you? When you got an idea, then how you started working towards it?
So my teacher, Dr. Dheeraj Daga, sir, always motivated me for going for DM medical oncology. So it was very inspiring because he was very good. He's very good in chemotherapy and drugs and guidelines. So yes.
Excellent, excellent. Now, once you decided to do a super specialty, then what all you did to achieve this? And what is your working strategy? What was your preparation strategy? How much time you dedicated for this?
Sir, I went through all the notes uh, once, like 3 months back. But my main like focus in the preparation was only last 3 months before exam. So mainly I studied for 3 months. Before that, I went through 80% of the notes and 80% of the MCQs in a log time of one year. Yes.
Great. So it was a full-time preparation for all this last 3 months.
Yes, it was a full-time preparation, but I had an issue with my cervical spine, so there used to be breaks in between due to that. Yes, so
Okay.
at least 1 and 2 days used to get wasted due to pain every week.
How are you?
Otherwise, it was full-time. Yes.
How are you okay?
No, sir. Right now, I'm also going through this issue.
So you are under some treatment?
Yes, sir. Right now, I'm under medical treatment, but I may have to go for surgery because the disc is indenting my cervical, yeah, spinal cord. Yes, sir.
I wish you a quick recovery
Yes,
and
sir.
be fine soon. And in spite of
Yes,
this neck issue, you
yes,
have
sir.
worked hard to achieve this. I really
Yes, sir.
congratulate you for your dedication in spite of health, that you're
Yes,
able
sir.
to make
Thank
such
you, sir.
dedicated hard work and perform. Hats off to you.
Thanks. Thank you.
Great. So, how many number of questions you answered in this exam?
So 146.
Okay. So, can you talk about something about this paper? What this paper is all about? What? I mean, is it about the super specialty
So the paper was really good this time. Unlike the last time when there were many questions from one topic, like 10 questions from Khurana score, 10 from A. This time the paper was well distributed among topics. All the topics were asked, and also the paper had like good distribution of difficulty of questions. Like there were easy questions, there were medium questions, and then there were hard questions. The paper was really very good, sir. Yes, sir. And it was also about decision making, clinical decision making, guidelines and all. Yes.
Okay. Very good. Very nice. Now, thanks for sharing. And
Yes.
what is the message that you want to give for the future aspirants of DM Medical Oncology?
So a message I will like well, start early and give more grand tests. Like I regret now I don't have to regret because I will get the seat I wanted, but I regret that I started giving duties only during the last month. So start giving GTs as early as possible because then we start improving the areas we are weak in. So that will be my message. Okay, start giving GTs early, start studying early. That then you don't have to struggle in the last because my basics were good due to radiation oncology. So I didn't have to struggle that much due to my pain. Yes, sir, in the last. Yes.
Great. And who introduced speed to you? What was your experience with speed for preparing for this exam?
Sir, I was searching on internet only, so there were some testimonies about the platform, so I chose speed.
So what was your experience? How it was useful for you for this exam?
So for videos, I watched mainly crash course, and for MCQs, I just went through one time like all the MCQs for videos.
Okay, great. Now time to thank and whom all you want to thank that they stood by you from day one till date, helped you to achieve what you're today.
So I would like to thank my family, my parents, my wife, my son, and my also my brother-in-law who helped me during my issues with cervical spine. He used to drive me to hospital and all. And I would like to thank my friends, Dr. Vijaypal and Dr. Tino. I would like to thank Dr. Dheeraj Daga sir, who always inspired me and also pushed me to study for medical oncology, sir, and to the platform, sir. Yes, sir.
Excellent. Congratulations once again to you for achieving a wonderful rank and also accomplishing your dream in spite of your difficulties and health issues. And we wish you a
Yes,
quick
sir.
recovery from that as well, and also to pursue your DM super specialty of your favorite choice of DM medical oncology. Advanced wishes and
Thank you, sir.
congratulations to you. Great
Thank
luck.
you, sir. Thank you so much, sir.